Many older adults choose to exercise early in the morning to support heart health, mobility, and general well-being. However, exercising immediately after waking, especially in low temperatures or without preparation, can significantly increase the risk of cardiovascular events, such as stroke or heart attack. This video outlines 5 clinically supported reasons why early morning exercise may be risky for adults over 60 and provides safe, practical guidelines to reduce that risk while maintaining the benefits of daily movement. Cardiovascular vulnerability. After waking, immediately upon waking, the human body is in a transitional physiological state. During this period, core systems are shifting from rest to activity. Blood pressure is typically at its lowest point. Heart rate remains reduced, and vascular tone is elevated, meaning the arteries and veins are more constricted than later in the day. These conditions are particularly pronounced in individuals over 60 whose cardiovascular flexibility and autonomic regulation may already be reduced due to age-related changes. A study published in Circulation by the American Heart Association 2019 found that the incidence of acute cardiovascular events such as myocardial infarction and stroke peaks during the early morning hours, particularly between 6 hours surge and 9 hours a.m. This trend is linked to circadian patterns in blood pressure, sympathetic nervous system activity, and platelet aggregability, all of which are elevated during the first few hours after waking. Older adults with underlying conditions such as hypertension, type 2 diabetes, or atrial fibrillation are especially susceptible. For example, Linda, 72, with well-managed hypertension, began morning power walks at 6:00 a.m. during the winter months. She experienced frequent lightheadedness and fatigue shortly after starting, which her physician later attributed to post-sleep hypotension and cold-induced vascular resistance. Her care plan was adjusted to delay activity and prioritize warm-up indoors, an evidence-based modification supported by geriatric exercise guidelines. Additionally, the Journal of Gerontology 2020 noted that age-related endothelial dysfunction, the diminished ability of blood vessels to dilate in response to increased demand, may impair older adults' capacity to regulate blood flow under exercise stress, especially during the first 30-60 minutes after waking. In practical terms, initiating even moderate physical activity too soon after waking may force the heart and circulatory system to adapt too quickly, increasing the risk of ischemia or arrhythmia. This is not limited to vigorous activity. Even brisk walking or cycling without transition time can be sufficient to trigger adverse responses in vulnerable individuals. The first critical recommendation is simple: allow adequate time after waking before beginning exercise. This transition period helps stabilize autonomic function, normalize blood pressure, and allow the vascular system to reach a more adaptive state for movement. For most older adults, a 15-30-minute delay, combined with hydration and upright posture, provides measurable circulatory benefits and lowers acute cardiovascular risk. In summary, although exercise remains beneficial, the body's natural physiology in the morning demands greater caution. Clinical evidence consistently supports avoiding sudden exertion immediately upon waking, particularly for older adults with known cardiovascular risk factors. The added risk of cold and low ambient temperatures. Environmental temperature is a significant external factor that influences cardiovascular response, particularly during early morning hours. Cold air exposure leads to peripheral vasoconstriction, a physiological process where blood vessels narrow to conserve body heat. While this mechanism is protective in moderate conditions, it increases vascular resistance, elevates systolic blood pressure, and may strain the heart, especially in older adults with reduced vascular elasticity. A meta-analysis published in the European Heart Journal 2021 reviewed over 22,000 cardiovascular events and found that ambient temperatures below 10°C 50F were associated with a statistically significant rise in hospital admissions for stroke and acute coronary syndrome, particularly in individuals aged 65 and older. The underlying mechanism involves increased sympathetic nervous system activity and elevated blood viscosity, both of which are accentuated in cold weather conditions. For seniors who exercise outdoors early in the morning, often before sunrise, these environmental risks coincide with the body's natural morning vulnerabilities. This compound effect makes the timing and setting of morning physical activity an important safety consideration. Cold-induced hypertension, a well-documented phenomenon, is also more pronounced in the elderly due to delayed thermoregulatory response. James, 68, began a daily routine of early walking at 5:30 a.m. during late autumn. Though generally healthy, he experienced intermittent chest discomfort during these sessions, which resolved spontaneously but recurred over several days. A subsequent stress test revealed underlying coronary artery disease. His cardiologist recommended shifting exercise to mid-morning, when both body temperature and ambient conditions were more stable. This small adjustment significantly improved his tolerance for activity and reduced symptom recurrence. Additionally, findings from the National Institute on Aging 2020 emphasize that older adults have a slower physiological adaptation to temperature changes and may not sense early signs of cold stress. As a result, they may continue to exercise in unsafe conditions, unknowingly increasing cardiac workload. Clinical guidelines recommend that individuals over 60 avoid outdoor physical activity when temperatures are below 12°C-54°F, particularly within the first hour of waking. If outdoor activity is necessary, appropriate warm clothing, gradual warm-up, and short initial durations are essential. Indoor alternatives, such as stretching, walking in place, or chair-based mobility exercises, may be safer options during colder months. In conclusion, while environmental exposure to cool air may seem benign, it can significantly elevate cardiovascular risk when combined with early morning exercise. Adults over 60 are advised to assess both internal readiness and external conditions before beginning physical activity. Delaying outdoor exercise until later in the morning, once body temperature and weather conditions have stabilized, is a well-supported strategy for risk reduction, risk-enhancing behaviors in morning exercise. Beyond physiological and environmental risk factors, certain behavioral habits common among older adults may unintentionally increase the likelihood of adverse events during morning exercise. These practices often stem from well-intentioned routines, but may conflict with age-related changes in cardiovascular and metabolic function. One of the most prevalent behaviors is engaging in physical activity immediately after waking, without allowing time for blood pressure to stabilize and cerebral circulation to normalize. Older individuals may experience transient hypotension or lightheadedness. The Journal of the American Geriatric Society 2018 noted that postural hypotension affects approximately 20–30% of adults over 65 with higher incidence observed within the first 10 minutes after rising from bed. Immediate exercise during this window amplifies the hemodynamic load placed on the heart. Another frequently observed pattern is skipping hydration. Overnight, the body loses fluids through respiration and perspiration. Morning dehydration, even mild, can concentrate the blood, increase viscosity, and impair circulation, particularly in those with pre-existing vascular stiffness or reduced renal function. A study in the American Journal of Clinical Nutrition 2017 emphasized that age-related declines in thirst sensitivity can lead to chronic underhydration, a risk often underestimated by seniors. Additionally, exercising before sunrise or in foggy, low visibility conditions presents dual concerns. Aside from colder temperatures, visibility issues increase the chance of falls or unsafe walking conditions, especially in individuals with impaired balance or visual acuity. While not directly cardiovascular, these risks compound potential injury and strain, particularly if compounded by suboptimal lighting or uneven terrain. Martha, 74, routinely walked outside at 5:45 a.m., believing early activity was essential for consistency. Despite no known cardiac history, she began experiencing episodes of spinning sensations and calf cramps within minutes of walking. Her physician identified a combination of mild orthostatic hypotension and early morning dehydration. Upon shifting her routine to 7:30 a.m. and incorporating 250 mmol of water before movement, symptoms resolved. Another critical oversight is neglecting to monitor blood pressure before exercise, particularly in individuals with hypertension or arrhythmias. Fluctuations in morning blood pressure can be unpredictable and may present without symptoms. The Hypertension in the Elderly program, 2020, emphasized the importance of home BP monitoring as a preventive tool. A pre-exercise reading above 160/100 mmHg or below 90/60 mmHg should prompt postponement of activity or consultation with a healthcare provider. Finally, starting with moderate to high-intensity movements, such as brisk walking, resistance training, or stair climbing without a proper warm-up, may overwhelm the musculoskeletal and circulatory systems. The American College of Sports Medicine, 2022, recommends that older adults initiate physical activity with at least 5 to 10 minutes of low-intensity movement to support thermoregulation, joint lubrication, and myocardial oxygen supply. Collectively, these behaviors can elevate risk, even in individuals who appear otherwise healthy. When corrected, however, they represent modifiable factors that significantly enhance the safety and effectiveness of morning exercise routines in aging populations. Adopting a more gradual and attentive approach can help preserve the long-term benefits of physical activity without compromising cardiovascular safety. Recognizing early warning signs. During or after morning exercise, while preventive strategies are essential, the ability to recognize early signs of cardiovascular distress during or after morning physical activity is equally critical. In older adults, warning symptoms can be subtle or easily mistaken for benign fatigue. However, timely identification and response can significantly reduce the risk of severe outcomes. The most commonly reported early symptom is dizziness or lightheadedness, particularly within the first 10 to 15 minutes of activity. This may result from orthostatic hypotension, vasovagal response, or impaired cerebral perfusion. A 2021 study published in the Journal of the American College of Cardiology found that transient dizziness during exercise was associated with an increased risk of arrhythmia and syncope in individuals over 65, particularly among those engaging in activity before 8:00 a.m. Shortness of breath that occurs disproportionately to the level of exertion is another key indicator. While mild breathlessness can be expected in deconditioned individuals, sudden or worsening dyspnea, especially if accompanied by chest pressure or fatigue, may reflect myocardial ischemia or heart failure exacerbation. Clinical guidance from the European Society of Cardiology, ESC, 2020 recommends immediate cessation of activity and clinical evaluation when unexplained dyspnea presents in older individuals. Chest discomfort, even if mild, should never be disregarded. Unlike the classic crushing chest pain often described in younger populations, seniors may report symptoms such as tightness, heaviness, or pressure that radiates to the jaw, shoulders, or back. These are often atypical signs of angina or early myocardial infarction. The National Heart, Lung, and Blood Institute, NHLBI, 2019 notes that older adults, especially women, frequently present with nonspecific or silent symptoms, increasing the likelihood of delayed intervention. Eleanor, 76, noticed a mild squeezing sensation in her upper chest after resuming early morning walking during the spring. Initially, attributing it to muscle tightness, she continued for several days. Upon mentioning it during a routine checkup, further evaluation revealed stable angina. Adjustments were made to her medication and exercise timing, with activity moved to mid-morning and paced gradually. This approach improved her tolerance while maintaining cardiovascular benefits. Additional signs such as nausea, unusual sweating, sudden fatigue, or confusion during or after activity also warrant attention. These can be early neurological or autonomic manifestations of underlying cardiovascular compromise. Importantly, seniors with cognitive decline, language barriers, or a high pain threshold may not report symptoms clearly. In these cases, observation by family members or caregivers plays an essential role. Abrupt changes in gait, facial pallor, or verbal confusion should prompt immediate rest and, if persistent, emergency evaluation. Clinical organizations including the Centers for Disease Control and Prevention (CDC) 2021 and Harvard Health Publishing 2022 emphasize the importance of stop rules during exercise. If any unusual or escalating symptom occurs, stop the activity immediately. Sit down and monitor. If symptoms do not resolve within a few minutes or worsen, seek medical help without delay. In summary, being physically active is beneficial, but situational awareness during morning exercise is crucial for older adults. Knowing when and how to respond to warning signs can be life-saving. Early detection, followed by appropriate modification or medical intervention, ensures that exercise remains a safe and sustainable part of aging well. Evidence-based guidelines for safe morning exercise. Age: 60 plus. Evidence-based guidelines for safe morning exercise. Age 60. Given the physiological, environmental, and behavioral factors that affect older adults during morning hours, adapting exercise routines using evidence-based strategies can significantly reduce health risks while preserving the benefits of daily physical activity. The first and most essential recommendation is to delay exercise by at least 15 to 30 minutes after waking. This allows the cardiovascular and autonomic systems time to stabilize. A clinical review published in the Journal of Geriatric Cardiology 2021 suggests that engaging in activity too soon after sleep disrupts circadian cardiovascular rhythms, increasing the likelihood of transient hypotension or blood pressure spikes. Allowing the body to adjust from a resting state before exertion improves perfusion, reduces dizziness, and lowers cardiovascular strain. Hydration should also be prioritized. Overnight fluid loss through respiration and perspiration leads to mild dehydration, particularly in older adults who often experience decreased thirst sensitivity. A study in Age and Aging 2019 noted that even a 1 to 2% decrease in hydration status can impair cognitive function and vascular regulation in individuals over 65. A glass of warm or room temperature water shortly after waking supports circulation, thermoregulation, and blood viscosity. The warm-up phase should begin indoors with light, controlled movements. Recommended activities include shoulder rolls, neck rotations, ankle circles, and seated stretching. These motions enhance joint lubrication, increase muscle elasticity, and prepare the cardiovascular system for gradual increases in demand. The American College of Sports Medicine, ACSM, 2022 emphasizes that warm-up routines are non-negotiable for individuals over 60, particularly when exercising in the morning. Delaying outdoor exercise until after sunrise is another key guideline. Sunlight provides not only environmental warmth, but also visual clarity, reducing fall risk. Exposure to natural light in the morning has also been associated with improved sleep-wake cycles, especially in older adults with disrupted circadian rhythms. According to the Sleep Research Society 2020, morning light exposure enhances daytime alertness and supports metabolic health, further reinforcing the benefits of mid-morning activity. For those with cardiovascular conditions or hypertension, pre-exercise blood pressure monitoring is highly recommended. Home monitoring devices allow individuals to assess their readiness for physical activity. Readings consistently above 160, 100 mmHg, or below 90/60 mmHg should prompt deferral of exercise until stabilized. The American Heart Association 2023 advises that morning is a critical time for BP monitoring, as it often reflects the highest risk window for adverse events. Richard, 70, was diagnosed with controlled atrial fibrillation and advised to walk daily. His previous habit of walking before 6:30 a.m. often left him breathless. After consulting with his physician, he shifted his activity to 9:00 a.m., added a 10-minute chair-based warm-up, and monitored his blood pressure each morning. This structured approach eliminated symptoms and improved both comfort and exercise consistency. Additionally, appropriate attire and surface selection play an important role. Older adults should wear layered, breathable clothing that can be adjusted as body temperature changes. Walking surfaces should be even, well-lit, and free of obstacles. Footwear should provide proper support to prevent falls and reduce joint stress. Finally, the exercise session itself should remain within a low to moderate intensity range, unless otherwise guided by a healthcare provider. This may include walking at a pace that allows for conversation, low-impact aerobics, or stationary cycling. The World Health Organization (WHO) 2020 recommends at least 150 minutes of moderate-intensity physical activity per week for adults over 60, spread across multiple days and adapted to functional ability. In summary, safe morning exercise for older adults is achievable through careful attention to timing, hydration, environmental conditions, and individual health status. By following clinically validated guidelines, seniors can reduce avoidable risks while maintaining physical activity as an essential component of healthy aging. Morning exercise remains one of the most beneficial habits for maintaining cardiovascular health, mobility, and independence in older adults. However, as highlighted in this video, the timing, conditions, and method of morning activity must be adjusted to match the physiological needs of the aging body. Exercising too early, especially in cold environments or without proper preparation, can elevate the risk of cardiovascular complications such as stroke, heart attack, or falls. The recommendations provided including delaying exercise after waking, staying hydrated, performing gradual warm-ups, avoiding low temperatures, and monitoring blood pressure are grounded in clinical research and public health guidelines. When applied consistently, these practices not only reduce risk, but also improve exercise tolerance, comfort, and long-term adherence. Adults over 60 should view these guidelines not as restrictions, but as tools for making physical activity safer and more sustainable. Whether walking, stretching, or engaging in more structured routines, adapting the way you move in the morning can help protect your health while maintaining the physical function needed for daily life. If you found this information helpful, please like this video, subscribe to Radiant Health 60, and share it with friends or family members who may benefit from safer exercise habits. Let us know in the comments. What time do you usually exercise? And how will you adjust your routine? We're here to support you in making informed, confident decisions for healthier aging.